to put the medallion around the neck of the orator, because it's a protocol. He has to do the oration with the medallion on. Nirmala, ওখানে Thank you, Tarun. Start your wish.
Good afternoon, all of you. Respected my beloved teacher and professor, Dr. Ashish Basu, and my senior, Dr. Nirmal Bole, and Dr. Amita Bhattacharya, distinguished guests, faculty members, seniors, and all dear colleagues and friends. Thanks, President Dr. Vijay Chaudhuri, and Secretary Anjan Das, and other all beloved dignitaries of the Medical College Student Associations, for giving me the opportunity to present today on most dynamic area of the most modern healthcare system of Profullo Bala Kiran Shoshi Nath Memorial Oration on stem cell. I, Dr. Tarun Kumar Sarkar, Department of Gynae Obstetrics, Eden Hospital, Medical College, Kolkata. My topic is today, innovating tomorrow's medicine and infertility care through stem cell therapy. Today I will discuss how the stem cells and stem cell therapy are transforming the modern medicine healthcare. Now I will begin by basic concept of stem cell and stem cell therapy and regeneration. Life begins with formation of zygote, a single cell created when sperm fertilizes egg in the fallopian tube. This zygote is ultimate stem cell, totipotent stem cell. Totipotent means it is ability to form an whole entire human body. That is 220 cell lines, all tissue of our body, brain, heart, lungs, CVS. So this is totipotent, and supporting tissue like umbilical cord and placenta. As the zygote divides, it 16 cells stays morula, and then it transforms to the blastocyst. The inner cell of the inner cell mass is pluripotent stem cells. What do you mean by pluripotent? Pluripotent stem cells meaning it also ability to form all tissue of the human body, brain, CVS, all human being to form, but not placenta. 3 germ layer, ectoderm, endoderm, and mesoderm. This zygote will billion of cell will form our human being. Now, stem cell. Stem cell has 2 properties: self renewal and differentiation. What do you mean by self-renewal? Self-renewal means they divide and maintain their populations. What do you mean differentiation? Differentiation meaning the cell differentiated to the specialized cell who need it in our body. Now, stem cell is immortal. What do stem cell is immortal? Because under normal circumstances, after each cell division, the end of telomere reduces in size until it reducible stage. Irreducible stage is initiated apoptosis. What do you mean by apoptosis? Apoptosis is programmed cell death. Other hand, the stem cell cultured in vitro cells deviate continuously to acts various way. It induces beta cell in diabetic type 2, myoblast to repair the myocardial infarction, in infarcted area of the heart tissue, myocardial tissue, skin, injured leg, hematopoietic stem cells, cardiomyocyte. In case of liver cirrhosis, there is a very good role of menstrual blood-derived stem cells. And uterus, infertility, and in vitro fertilization. Endometrial stem cell located in the basal layer of the uterus and is cyclical regeneration of the each menstrual cycle, and ovarian stem cells also. The stem cells in IVF and reproductive medicine. Stem cell therapy for poor ovarian reserve, premature ovarian insufficiency, in case of thin endometrium, recurrent implantation failure, mesenchymal stem cell derived from bone marrow, adipose derived stem cells, induced pluripotent stem cells, and umbilical cord blood derived stem cells. Ovarian rejuvenation improved by stem cell therapy, follicular recruitment, vascularity of ovarian, hormonal function, AMH and antral follicle count improves after stem cell therapy or PRP based therapy. Thin endometrium is major cause of implantation failure in case of infertility. Mesenchymal stem cell promote 1. Angiogenesis, anti-inflammatory effects, and endometrial tissue regeneration. Endometrial stem cell, oocyte regeneration. That is the mesenchymal stem cell therapy and agiospermic navigated differentiation of challenge and charting future frontier male infertility treatment. And other intra-ovarian installation of the mesenchymal stem cells. Autologous stem cell in transplantation in poor respondent, that is the bone marrow derived stem cells, and type 2 diabetes mellitus, a randomized placebo controlled study. Infertility is not just a medical condition, it is emotional journey faced by millions of couples in the whole worldwide. Infertility males not able to conceive even after 1 year of regular unprotected intercourse. The cause can be either both partner, in ovulation, fallopian block, and PCOD-like condition. In low sperm count, agiospermia, and poor sperm quantity in men. Male infertility, there is a spermatogonial stem cell located in seminiferous tubules and responsible for lifelong sperm production. Agiospermia, testicular failure, chemotherapy-induced fertility, varicocele associated damage, genetic defect, Sertoli cell dysfunction. There is stem cell therapeutics in male infertility, Mesenchymal stem cell restores spermatogenesis, seminiferous tubules regeneration, reduction of oxidative stress, blood testis barrier repair, microenvironment restoration, immunomodulation, IPC based induced pluripotent stem cell used for gamete regeneration. Amniotic membrane and fluid derived stem cells. These cells include amniotic epithelial cells, human amniotic mesenchymal stem cells, amniotic fluid stem cells. What is the mechanism of action? Low immunogenicity, anti-inflammatory, immunomodulatory, high regenerative potential. Clinically applicable is wound healing, particularly in diabetic ulcer, food ulcer, corneal ulcer, chemical injury repair, ocular surface reconstruction, and orthopedic bone regeneration, osteogenic differentiation, cartilage regeneration. Cardiac regeneration reduce inflammation, cardiomyocyte repair, and fertility restoration, endometrial regeneration, intrauterine adhesion repair from the amniotic membrane, fluid derived stem cells. Next, very good source of mesenchymal stem cell, dental pulp stem cells. Easily accessible with characteristic mesenchymal stem cell marker. Functionally, they contribute to tissue repair, differentiation, odontoblast-like cell, secretion of growth factors, and immunomodulatory effects. Clinically, DPSC are used in regenerative odontics for pulp regeneration, dentin repair, bone regeneration, periodontal repair, and neural tissue engineering, that is neural crest origin. Menstrual blood stem. Menstrual blood derived stem cells are easily accessible. Cell differentiation, gynecological disorder, musculoskeletal soft tissue injury, chronic liver diseases, peractrin is anti-inflammation immunoregulation, promote angiogenesis, tissue repair, and anti-fibrosis. Immunomodulation, it helps tissue repair, regulation of immune cell function, and improvement of the release of cytokines and signaling pathways. Versus umbilical cord blood, UCB. Umbilical cord stem cell just as bone marrow. Hall E. Broxman said in 1983. UCB transplantation nucleate a cell with HLMS, that is the transplantation, which history of Hankon delivered by Ellen Glagman, that is 1918. He used in Harrow's Matthew, twin sister collected from blood in New York and introduced in the Matthews in Paris. First incidents of the UCB transplantation in the world. UCB umbilical cord blood transfusion as alternative to adult blood transfusion in anemia. In various etiology in 1990 by Professor Dr. N. Bhattacharya by School of Tropical Medicine, Kolkata. 2050 in India, government set up the first cord blood bank in Calcutta. Umbilical cord blood is admixture of fetal and adult hemoglobin, high platelet, WC kind, several cytokines and growth factors, as well as hypoantigenic nature, potential safe alternative to adult blood transfusion. In any case of disaster in the world, or UCB also raise CD34, or the hematopoietic stem cells, plays adjuvant immunopotentiated therapeutic effect. Now, goal from West, role of umbilical cord blood. It is my paper in international conference. And next, other side, paired-rich plasma in the management of vulvo-vaginal disorder, systemic review. This is the cosmetic and regenerative gynecology. The extensive role of stem cell therapy in future, regeneration cosmetic gynecology. There is a reduce of menopausal symptoms, tissue repair, reduce inflammation. Now, umbilical cord stem cells. There is a mesenchymal stem cells, very rich source of umbilical cord. Umbilical cord derived stem cells, rich, ethical, non-invasive source from the collection from water and breathing. It has highly proliferative capacity, low immunogenicity, and strong immunomodulatory effects. It differentiated to the bone, cartilage, muscles, and neural cells. Clinically, extremely studied in orthopedics, neurology, wound healing, and reproductive medicine. In IVF practice, they show improving endometrial regeneration and implantation outcome. Reproductive disorder, clinically they are explored for treating conditions such as Parkinson's, diabetes, spinal cord injury, and cardiac diseases. Importantly, induced pluripotent stem cells overcome many ethical concerns. In future, where damaged tissue and organ can be repaired using a patient's own cell, truly transforming the landscape of the modern medicine in future. This is the story. Regeneration. What is regeneration? Regeneration, 1500 BC, described in Ved. A reconstructed surgery to 6000 BC maintained regeneration and stem cells. And in ancient Greek mythology, 500 BC, Prometheus. Prometheus, who gave fire to the humanity, was punished by Zeus. He was chained to a rock in the Caucasian mountain, where an eagle came every day to eat his liver. Remarkably, during the night, his liver regenerated only to be consumed again next day. This is myth, not in scientific evidence. But now you know the liver is only solid organ capable of regeneration. Even after 70% of surgical removal of the liver, the remaining tissue can proliferate and restore through liver through coordinated cellular regeneration. Regeneration story, 2000 billion of RBC, 10 billion of WBC, and several billion of platelets are produced in our body per day. It is the stem cell, or hematopoietic stem cell. Next, cyclical regeneration of the endometrium in women, cyclical menstrual cycle. Now, very important, adipose derived stem cells. Adipose derived stem cells, adipose, correction from adipose, the minimally suction from liposuction from the adipose, then proteinase and collector stem cells and culture and expansion ex vivo to collect a dose of stem cell, particular mesenchymal stem cells. Human adipose derived stem cells undergo neural stem cell stage before committing neural fate. Tissue engineering with stem cells, very important, as now tissue engineering combine stem cells, scaffold, and signaling molecules. Tissue scaffolder provide regenerate potential, stem cell provide regenerate potential, scaffold act as 3D framework, three-dimensional framework. Growth hormone, differentiated and tissue formation, cell attachment, proliferate, and organize within the scaffold. Extra ECM, extracellular matrix production, strengthen the construct. This engineered tissue mimic native biological structure. This can be implanted into damaged tissue. These widely used in bone, cartilage, and skin repair. Earlier, 2013 replaced a cartilage. "3D bioprinting." What do you mean 3D bioprinting? Stem cells are combined with biomaterials to form bio-ink. Using computer-guided printer, this bio-ink is deposited layer by layer to create natural human tissue with help of bioreactor with stem cell. Proliferation, differentiation, organized to functional tissue. For example, skin, cartilage, and functional tissue for organ transplantation in future. That is very important. Cas9. What is CRISPR? Gene editing tool. Targeting specific sequence of DNA